So I grew up in a family of doctors. My father is a physician, he's a retired gastroenterologist, and my sister is a pediatrician currently practicing in India. So growing up in that household, you can kind of see the joy and satisfaction they were getting from treating patients. And also with my background in science in undergrad, in college, I did biology with a minor in biochemistry, or nutrition, sorry. It was the natural pathway for me to go into. And I've thoroughly enjoyed it so far, taking care of patients and helping them with their chronic illnesses. I grew up in Canada, and I did my undergrad training at the Medical College of Memorial University of Newfoundland. 4-year degree in biology with a minor in biochemistry. Following the completion of my undergraduate degree, I ended up going to medical school at Ross University in Dominica. And then following that, I did my residency, 3 years of internal medicine and 2 years fellowship in endocrinology at the Medical College of Georgia in Augusta, Georgia. Started my first job in 2010, and we ended up moving to Chattanooga about 4 years ago. And the reason I ended up here is because I found out that Bradley was looking to develop a new program and a service line in endocrinology, and I felt it was an exciting time and challenge for me to take on, so ended up pursuing the opportunity. So endocrinology is really a field that encompasses the whole body, head to toe, hormones and the organs that produce those hormones, so multiple diseases including diabetes, pituitary disorders, metabolic bone disease like osteoporosis, Paget's disease, and adrenal disease. So the way I handle these conditions is I put the patient first and take a patient-centered approach. I look at what experiences they've had before that have brought them to me, what symptoms they're experiencing, how it's affecting the quality of life. And then we come up with a plan that encompasses and incorporates both dietary changes, lifestyle changes, and also medical therapy as needed. So we like to put a whole picture to the plan. Well, I think it makes it a lot easier for the patient. I mean, commuting to Chattanooga, especially for my elderly patients, can be cumbersome. Traffic, sometimes the weather in winter, and just also the time. It takes about 40 to 45 minutes depending on where you're coming into to Chattanooga. So to provide that service locally will make it much more accessible, and the patients will be much more willing to come to their appointments, and so we'll be able to provide the care that they need. Like I do with all my patients, I tell them it's really their care, their health that is very important. So I put the patient first, I listen to them, I take their whole story. I don't like to rush into medical therapy. I like to see if there's any preventative or lifestyle changes we can make first, such as dietary changes or, in terms of lifestyle, like increasing physical activity to help with blood pressure or help with their diabetes. And then finally, if needed, we'll add medical therapy. So I like to put everything together for the patient and present the best approach. Well, working in different hospital systems, you get to appreciate taking care of a multitude of different patients, ranging in complexities. Also, you got to see how to effectively run a practice in different settings and how to deal with insurances, so that way we can provide the best for our patients. So I bring that experience with me to Cleveland. So I chose Bradley Medical Center because for several reasons. One is the opportunity to start a new practice from the ground up, develop it in such a way that would cater to the community, be able to hire staff that will work well with my philosophy, and just provide a much needed need to the community. That was the biggest reason. What stands out is I always listen to the patient. Everyone has a different story, everyone has their own experiences. I'm willing to take the time to listen, and I always come up in conjunction with the patient, the best care of action for them. I believe in the mission statement that they have. I believe in what they're trying to do here in the community, provide excellent service and provide much needed healthcare. And so I'm glad to be part of that team or join this team.